Irene is MHLP student in health policy and leadership in UBC, a master's student. And she's also a research assistant in my lab in UBC. So over to you, Irene. She's going to present the poster that we have done a study in for this smart audio device that we used during the pandemic.
Lillian, are people able to see the poster?
Yes.
Okay,
go ahead.
Perfect. So, okay, I'm just going to introduce our project. This is led by Dr. Lillian Hung and follow with our team members. Our project is using a smart audio device, Talkie, to stay connected with the families during the COVID-19 outbreak in long-term care facilities. So Talkie is a speaker device that allows family members to record and send messages to their loved one in the long-term care. We collected the data through pre and post intervention focus groups and weekly check-ins with the residents, family, and staff into long-term care facilities over 4 weeks intervention periods. So upon analysis of our data, we recognize 4 themes. The first one is the Talkie fosters the emotional connections. Residents stated that they feel connected with the families when hearing the messages. Talkie enabled them to show their loved ones that they are thinking of them. One of the families shares a really touching experience that her father has a little verses that he said to the mom, how much he loves her. And the Talkie came with the father's voice, and the mom face lit up, and she's pointing to the Talkie and muffling that she lost him so much. That makes also is a really priceless for the families and also to the residents. That also being really meaningful for our study as well. And secondly, Talkie also supported with the connection in creative and personalized ways. Some families came up with ideas to use the Talkie to to show the care and affections. They recorded their voices reading chapters of novels or recorded their favorite songs to the residents. The third one is the contextual considerations, which presented as barriers to Talkie usage in long-term care. Some residents were not familiar with the devices and require support from the staff and families to ensure the device functions. Staff support and collaboration between the families were very essentials for the Talkie usage. And also we noticed the Wi-Fi connection limitation was another contextual consideration that affected the Talkie usage. The last one, we asked the participants what they look for in the future of the Talkie design development. The suggestions include the voice comments to control the recording functions and portability, so the residents can hear the messages on the way they go, and also the other ability of two-way communication between the residents and the families when using the Talkie.
Thank you, Irene. So that's our presentation. So some of the themes that comes up that the residents use the Talkie for 4 weeks of time, and that's the intervention time that we had in the study.